Hi, I'm Dr. Vishal Shah from Richmond Bone and Joint Clinic, and I want to talk to you today about arthritis. Specifically, I want to talk about osteoarthritis. We're going to cover what arthritis is, what signs and symptoms exist for arthritis, how you know if you might have it, and lastly, what to do if you think you have it, how to make it better. First of all, what is osteoarthritis? There's two main types of arthritis. There's rheumatoid arthritis and osteoarthritis. Osteoarthritis is the most common type of arthritis, and that's the one we're going to focus on today. It's the kind of arthritis associated with wear and tear and kind of pain in your joints as you get older and more active, and that's the most common type and the type that affects most of our athletes, weekend warriors, people doing their everyday jobs, and just about everything else in between. So that's what we're going to focus on. What arthritis is a degeneration of the cartilage cushion that exists in all of our joints. Our joints are our moving parts, and over time the cartilage that cushions those joints degenerates, leading to pain and stiffness and swelling. And that's really what arthritis is. Cartilage that's normally found in our joints is a great combination of a very smooth material but also very durable and very cushiony. And that combination has been hard to duplicate in science and in the laboratory, and that's why nothing is quite as good as your own cartilage. And when that cartilage starts to degenerate, that's when you see the signs and symptoms of osteoarthritis. To talk a little bit about what osteoarthritis really is, I'm going to use some of these knee models. The knee is the most common joint that most people complain about arthritis. You can get it in any joint in your body, including your hips, the small joints of your hands, shoulders, back, but the most common joint we see it and we see the problems of it is in the knee. So this is what we would consider a normal knee model. We've taken away the muscle, the skin, and the soft tissues on the outside so we can look inside the knee. What you see is the normal knee, the bone, is covered by a smooth, uniform layer of cushioning tissue called cartilage. And that cartilage is what makes the knee move smoothly, or makes any joint move smoothly without pain and discomfort. What happens in arthritis is this cartilage starts to wear down. It's very analogous to the tread on a tire. And as that tread on the tire wears down with use and mileage, the cartilage starts to wear out, as does your tread. So here's a model of a knee with a lot of arthritis. You can see that nice, smooth cartilage that you initially saw on the normal knee is kind of worn down in multiple areas. Some of these areas are completely worn down to bone. That yellow stuff underneath the cartilage is completely worn away, and it's not a nice smooth surface anymore. It's very bumpy. You can see the changes have affected both bones here, both joints, the femur and the tibia, and you also see signs of bone spurs around the knee. Those are your body's best way of trying to react to the arthritis. It doesn't really help at all, but it's the only thing the body can do. The body can't form new cartilage, it just can form new bone. So this is an example of a worn out knee. Again, the tread on a tire comparison comes into play. The cartilage is just worn out, and once that bone is exposed, that's where the nerve endings are, and that's what causes pain. This can affect either one part of the knee exclusively, or can affect all three compartments of the knee, including both sides and underneath your kneecap. And again, it can happen in any joint of the body in the same way. So now I want to talk a little bit about what causes osteoarthritis. The main causes of osteoarthritis are going to be genetics, wear and tear or injury to the joints, aging, and then possibly unknown factors that we've yet to discover. Overall, it's usually a multifactorial cause, meaning all these factors work together in order to result in arthritis in some patients at an earlier age than at a later age. First of all, genetics. If somebody in your family had bad joints, then you're probably at higher risk for developing arthritis at some point in your lifetime, maybe earlier than normal. The second thing would be wear and tear or injuries to the joint. Just normal wear and tear, if somebody's very active, kneeling, squatting, running, high impact sports, those things can accelerate the arthritic process of your joints. Normal aging can also result in degeneration of cartilage, and even if you don't do anything high risk or high impact, there's a chance you can develop arthritis just because of genetics or just because of aging. An injury to the joint can accelerate the damage to the cartilage. Lastly, there may be some unknown factor that science has yet to discover, possibly a virus or a gene that some people have and other people don't, that may be switched on by certain environmental factors. So in general, the causes of arthritis are multifactorial, or they're caused by multiple factors that work together. The next question is, how do you know if you have arthritis? What are the signs and symptoms? The most common signs and symptoms are going to be pain and stiffness of a joint. Aches and pains can be related to multiple problems. They could be related to joint problems like arthritis, or it could be muscle problems, tendinitis, muscle weakness. The joint problems related to arthritis are specifically in a joint, in one of the moving parts of your body, whether it be your knee or parts of your hand, shoulder, hip. The main signs are stiffness and pain. The pain is going to be more associated with activity. The more you use that joint, the more it's going to hurt. The stiffness can be found in the morning or get worse throughout the day. Both are classic signs of arthritis. Sometimes swelling and grinding of the joints are also signs of arthritis. So in general, pain and stiffness that are associated with activity, with occasional grinding and swelling, can all be signs of arthritis. So what can you do if you think you have osteoarthritis? There's a lot of things you can do on your own at home, and then some additional things that a doctor may be able to help you with. On your own, one of the first things you can do is to lose a few pounds. For every pound of weight you lose, your knee reduces the force by 3 to 6 times that amount. So losing 1 pound in your belly, for instance, may lead to 3 to 6 pounds of weight reduction to the forces on your knee. So that alone can help you quite a bit. The other thing you want to try to do is modify your activities. If you find that your pain is worse after running or after impact sports such as basketball or soccer, then you might want to try to cross-train. Reduce the activities that cause the pain, but still stay active and fit by doing other activities that are lower impact activities. These activities would include biking, elliptical, cross-training, swimming, and other sports that don't involve as much pounding and jumping and change of direction to your joints. And of course, different joints are affected by different sports. The next thing you want to do is try to take over-the-counter anti-inflammatory medications and pain medications as needed. Things like Tylenol arthritis or Aleve. Things like that are very safe if used in moderation. Of course, if there's any questions, you should talk to your doctor before trying those things. Another thing that can help with arthritic joints may be nutraceuticals such as glucosamine and chondroitin sulfate. There's a lot of these supplements on the market. Some of them are very good and some of them may be not as good. It's important to use a reputable brand. There's a lot of good evidence that shows these supplements can really help people with joint pain. They probably can't reverse arthritic changes, but they certainly can help the symptoms that they might produce. Next would be strengthening of the joints involved. If your knee is giving you problems, it makes a lot of sense to strengthen the muscles around your knee, because by strengthening the supporting structures, you can decrease the pressure on the joint itself. So that goes for any joint that you might have pain in. You want to do low resistance, high repetition activities to tone those muscles without putting too much undue pressure on the joint. Something as simple as ice can also make a big difference in arthritic joints. A joint that's arthritic gets inflamed and painful and sometimes swollen with overuse. So ice is very good at reducing the swelling, reducing the pain, and kind of putting that joint back down to a normal state for the rest of the day. So icing after activity is generally very helpful for an arthritic joint. Finally, if you find you're still having persistent swelling, pain, instability, or problems with a joint that just doesn't seem to respond with these early treatment measures, you can always seek medical attention. It'd be important to get an x-ray of the joint and a physical examination to evaluate the stability of the joint. Sometimes other problems can present that may mask as arthritis, but may be something very different. And for those certain other conditions, treatments can be started that can prevent future arthritis and other damage to the joint. So bottom line is, if the things you try at home aren't working after a few weeks or so, it's probably important to go ahead and get an x-ray and a medical evaluation. So in summary, osteoarthritis is a degenerative condition of the joints in which the cartilage that normally cushions your joints has worn out. The normal signs of arthritis are pain, swelling, and stiffness, and generally those are activity related. The more activity you do, the more symptoms you have. If you think you have arthritis and some of the over-the-counter remedies we discussed aren't helping, I would recommend seeking medical evaluation. A simple x-ray can be the first and easiest step to diagnose arthritis. And certain other treatments are available by your physician. These could be in a combination of injections, prescription medications, physical therapy, and potentially surgery if the condition is bad enough and nothing else has worked. I'm Dr. Vishal Shah. Thanks for taking the time to watch this video. If you have any additional questions or seeking more information, you can go to our website at www.rbjc.com for Richmond Bone and Joint Clinic.